Hey everyone, this is Vaughn at Spirit of Health, and I wanted to talk today about heart disease. And we have to talk about heart disease because pretty much everyone knows it's the #1 killer of human beings. And I don't believe it was God's intention for anyone to die early, especially of a heart-related episode. And I want to be sensitive in this area because if you're watching this, you probably know someone or have a loved one who has possibly passed or had a heart attack. I mean, I had an uncle who had a quintuple, 5, like I hadn't even heard of that, 5 bypass heart surgery. Like this is a really serious problem. So the question is like, why is this happening? Why is this going on? And I think there's a lot of confusion in this area. And this is an area where we need to understand practicing prevention because we all know that it can be an episode and that can be it. So how do you even have this on your radar? How is this even on your brain that this is a possibility? Maybe because it's in your family, or maybe it's because you're overweight, or you have various health issues. But I love to give people real practical solutions, and I've worked with thousands of people, and so I'm gonna give you some real super awesome, simple, practical solutions today. And I'm gonna make a pretty bold statement, so we'll get to that related to what I think about this issue with heart disease. And so everybody knows the buzzwords of exercise and good diet, and what does that even mean anymore these days, right? But obviously there are things that are causing it. There's something leading to people having these chronic heart problems. If you look at animals in nature, they're not just dropping from heart attacks. They're not just dropping from stroke. So I believe that it's something we're doing to ourselves. It has something to do with our culture, our diet. I really believe, if I just want to give you a very simple thing that I think is a main cause of heart disease, it's overconsumption. It's overconsumption. I'm a huge fan of fasting. So if you want to change your life, and intermittent fasting, another big buzzword out there everybody's talking about, if you want to change your life, eat 2 meals a day. What's the typical American standard? 3 meals a day plus snacks. You basically eat whenever you want. That's overconsumption. That's going to lead to clogs or congestion in the body, in the arterial system, in the lymphatic system. And so really what heart disease is, it's congestion. It's the body being so clogged and overloaded with toxins that it can't break down and eliminate, whether that's cholesterol or lipids or triglycerides, some of the things we check right when we check our blood, that are just gumming up the system, and they're leading to a system failure, basically, whether that's carotids related to a stroke or whether that's the arterial system around the heart leading to heart attacks. But it's absolutely 100% preventable, and that's what people need to understand. And yes, does diet matter? Yes. Does exercise matter? Yes. All those things are important, but I really believe overconsumption of food is the #1 thing. So that's why I just really wanted to drive that home. If that speaks to you, great. I work with lots of people with chronic health issues. People don't necessarily come to me with heart disease, right? A lot of people have an episode and they go to a cardiologist to get checked out, right? But people come to me and they have heart issues in their history. So one of the tests I run, I want to share with you because I just love this test, and you'd have to be, here in Kansas City at our wellness center to have this test run. But it is a HRV, it's a heart rate variability type of test, but it actually checks to see from a 1 to a 7 if you have blockages in your arteries. Super accurate. I've been using it over 10 years. It's amazing. If you have clear arteries, you're in the 1-2 range. If you have clogged, blocked arteries, you're in the 4-5-6 range, and that's a serious issue. And then what I get to do is share that information with people and give them a very simple program and watch that revert back. So yes, you can clear out blockages out of the arteries, and I'm going to tell you how to do that so you can prevent these issues for yourself, for your family, even if it's in your family history. It shouldn't be about your family history. It should be about the choices you're making today. So if somebody comes back with a level 5, level 6 blockage, they can go back 4, 3, 2. I'll recheck them every month until that thing's at a 2. And it works. It works 95% of the time. I have had a couple stubborn ones, and I think it's because they're severely calcified. If you've heard of calcifications in the arterial system, yeah, those are really hard to break down, like a calcium deposit out of the arteries. But most people just have what I was talking about earlier. They have this accumulation, this congestion, this extra fat and cholesterol and this junk kind of gumming up their system. And so how do you clear those out? I'm going to share it with you. I'm going to give you a very, very simple plan that you can use to either reverse heart disease or at least prevent it. Now, here's that bold statement. Remember I said I was going to make a bold statement? I believe if you do these things, it's impossible for you to have a cardiac episode. That's a huge statement, but I've been saying that to people for 10 years and I stand behind it because I firmly believe there's things you can do to keep our blood flowing nicely and unsticking. And if you look at blood under a microscope, you'll see people have rouleau, and that's where these red blood cells are stacked up on top of each other and they're not moving, but blood should be little individual red blood cells just flowing perfectly fine by each other. And people's blood isn't doing that. So how do you unclog the blood, or how do you break down this sticky blood? So here are the things you do. Number one, I do believe diet matters. So yeah, you should be eating whole foods, not overeating all those bad fats. PUFAs is a term they use for these polyunsaturated fatty acids, but you know, fast food. And if you're watching this, you probably know not to eat fast food, right? So I'm not telling you anything you don't know, but I do love a healthy diet, like a paleo type of a diet where you're mainly eating fruits, veggies, some quality proteins, a little bit of healthy fat, but there's no doubt diet plays a role. So the first thing I tell people is the easiest thing to do is intermittent fasting, 2 meals a day. If that feels torturous to you, I promise it's not. You have to train your body from feeling like you need to eat every time you're hungry to actually train your body to eat 2 meals a day, and it's super easy. Anybody can do it. I said I mostly work with women. Women do it all the time. They'll eat lunch, they'll eat dinner, they'll eat a quality meal for lunch and dinner, they'll fast 18 hours. Okay, that can reverse like a myriad of health conditions. But what you're doing is you're stopping the overconsumption and you're taking a break off the system, and God designed the system as a self-healing, self-regulating mechanism that can break down and move those toxins and poisons out of the body at any time if we allow it to do so. So that's the first thing. Second thing is an enzyme blend, and I'm gonna highlight Nepronol by Arthur Andrew Medical. I've been using it over 10 years. It's a proteolytic enzymes. So proteolytic means it's a protein-eating enzyme, and it breaks down these excessive proteins that are built up in the body. And I describe Nepronol, or these what are called systemic enzymes, like Pac-Man. You remember, like, I might be dating myself, but I played Pac-Man back when I was a kid, but it's, you know, it gobbles up like old, sick, dead, diseased, dying tissue, the cholesterol deposits, the fatty deposits, even scar tissue, like it gobbles that stuff up. They're proteolytic, protein-eating enzymes, and they keep the blood from sticking together. So you can actually take a drop of blood from somebody, see it sticky under the microscope, give people a few capsules of Nepronol, check it an hour later, and their blood's not stuck together. Like, it's amazing, I've seen it. So Nepronol not only keeps the blood from sticking together and it keeps it flowing, but it also breaks out that old deposit. So that's one. Number two is nitric oxide. A lot of people know about. I like the one by Bionox, but the nitric oxide is gonna have, so beets are super high in nitric oxide. There's other berries and different things are, but it has citrulline, arginine. These are amino acids that open up and vasodilate the arterial system. So if you think about what you're doing with what I've told you so far, is you're cleaning out the arteries and getting the blood flowing well. You're dilating the arteries with nitric oxide that actually heals the endothelial cells. It actually heals the lining of the arteries and also opens up blood flow. And then the third thing is magnesium. Magnesium, and you guys know you need magnesium. You guys have watched stuff on magnesium, but it's crucial for healthy arterial function, and almost everybody's chronically deficient in magnesium because our culture is super stressed out. And if you don't have enough magnesium in your system, guess what? Your arteries constrict. So you need magnesium to deal with all that stress, to open up the arterial system, to relax the smooth blood vessels. And I like Magnesium ER by Mother Earth Labs. That's the supplement I recommend because it has 7 different forms of absorbable magnesium. So Magnesium ER by Mother Earth Labs. And I'll also mention Health and Wisdom. They have a magnesium chloride oil, and what you do is you do foot soaks. So this is amazing, given to people like right before bed, helps with sleep, relaxes the body, replenishes magnesium when you're depleted. But you actually buy the oil, you get a little foot tub, put a couple ounces of warm water in it, just enough to cover your toes, and then add a couple ounces of this magnesium oil. And it comes with instructions, but it's super easy to do and a phenomenal way to restore magnesium levels. And I'll have people do that for like a month and then take the Magnesium ER. So there you go, like there's your solution. There's your very practical way to prevent or reverse heart disease through diet and intermittent fasting, through Nepronol or a good systemic enzyme, through nitric oxide, again by Bionox. Of course there's other ones out there, and then finally magnesium. So I just hope and pray that this helps you or a member of your family that needs to hear this. God bless you.